Let's now pass on to another issue regarding Teleton projects. But before, I would like to share with you shortly a few hints that came from a convention I participated in this very week in Dublin. This is the IRDIRC convention. IRDIRC is an international consortium that was established by the research founders as regards rare diseases, Teleton, and large funding institutions and governments in the industry are also players. There was this meeting to strategically talk and summarize what the experience is as regards research on these innovative therapies for them to become consultancy bodies for NIH and the European Union to define in a more effective way some research protocols for rare diseases. Some very interesting hints came out, and as very short flashes, I wanted to share them with you. First, I was hit by a very positive, concrete attitude that was not just chit-chatting. It was really a meeting with the right people, people from the regulatory framework, NIH, very representatives from very large associations, patients associations, clinicians and researchers, of course. And we actually tried to understand what we have learned up to now and what are the problems we should expect, how to speed things up. The first aspect that was very much stressed is that of not fearing breaking the established models, thus creating real new collaborations were required with new counterparties involving the patients' associations in the different phases to prepare the studies, and not only as patients in themselves that participate in the trial. So, in these collaborative models, considering flexibility and the need of rare diseases to be flexible, always in compliance with good clinical practice rules, because shortcuts do not produce solutions. Another very important aspect was that methods and results were shared. We had here an excellent example this morning of how positive research, translational and clinical research is doing, because those studies that require so much time because they are starters, they require time, right? Because it is required to characterize the systems, how to set up techniques for the reinfusion following a treatment. Well, they must be used as an experience to speed up later on the application of these innovative techniques to other forms of the same pathology or other pathologies that might benefit from this method. Another concept that was strongly stressed was the fact that limits on funding imposes that we do not waste anything. And in doing this, a very interesting idea came up that was proposed by NIH, and they are already working on that with the industry, that is the so-called repositioning or repurposing, with the idea of repositioning, repicking those molecules or drugs which the company has already characterized as regards toxicology phase 1, phase 2, but which were later then discarded because they actually did not demonstrate they were too effective. Of course, not those that were discarded because they had low safety profile or they were toxic. On those molecules, great investments were made. Their action mechanism, chemistry, and distribution in the body are well known. And this is a real resource capital, information capital, which we cannot waste. So, this possibility was made available, offering researchers these molecules for them to think whether, compared to the mechanisms and the diseases they are studying, these very molecules might reveal to be positive drugs. thus restarting a new path that might consider, for it to be successful, some specific fundamentals. First, there must be a positive collection of information regarding the disease, natural history by the clinicians and by the people hit by the disease, with the creation of registries to collect these data in a very accurate way. And second, the importance of very detailed studies on the action mechanisms. So basic study gets back to its central core action, because if we want to hit the target, we must know these mechanisms pretty well. And the other aspect is that the researchers proposing these studies must protect these ideas under patents, because no industry will ever invest on them if there was no protection upstream through patenting of the new use application. Teleton investing 60-70%, perhaps even more of their own resources in basic studies on in vitro mechanisms. Well, that was actually very positive for all of us, because we have always strongly believed in the importance of having good basic starting data. But we were also criticized because research then takes very long times to develop. However, in this case, this type of an investment may reveal to be pretty precious, right? Because there is already a speed up way that can be exploited. So we were strengthened also in our way of operating. Talking about innovative modalities, Alberto Fontana this morning already introduced a project that was launched last year thanks to the GFB group, together with Teleton, to finance researchers who might open up to new ideas, researchers who had studied a mechanism, had some knowledge on them, and which might be transferred onto other diseases too, with the focus on neglected diseases particularly. And we are having two presentations today, but we also have Professor Dr. Claudio Bruno in the audience. And they were financed following this criteria. We financed 11 projects, and about half of them were on GERDO